Through the years, it's helped me identify, honor, and feel my emotions. It's helped me learn to communicate what I'm thinking and feeling, to challenge negative thoughts and biases I hold. It's helped me create self-compassion and recognize choices I have to change circumstances when needed. Therapy isn't easy, but having the right therapist can help someone remember they don't have to go through things alone.
Hey there, my name is Dr. Beth Russell, and I want to know, what would you do if you were not afraid? Right now, what would your life, your job, your relationships look and feel like if you could be unapologetically you? What's holding you back? This podcast is for anyone that wants to make a change but isn't sure where to start. Let's look inward together and let's talk about you and me, our mental health, our self-care, inner and outer selves, and all that makes us, well, us. It's time to get real, feel the feels, challenge what's holding us back, and connect. This is the Authentic and Brave podcast.
Recently, I got a note on Instagram from a listener. She wrote to me about her recent loss of a job and how she wants to shift gears to starting something new. Realizing she was struggling a bit, she asked me about therapy, what it is, if it really helps people, and how she can find a good therapist. In her words, I saw what so many people struggle with. First, the uncertainty as to what therapy actually is and if it can really help her feel better. Second, she was experiencing a life transition for which she has a lot of different thoughts and a bunch of emotions, fear, sadness, excitement, among many others. And third, she wants to know how to find a therapist that really fits for her. So in addition to writing her back, I decided it would be a good topic for this week's episode. I started going to therapy when I was 16 and pretty much have gone off and on ever since. I had some really good experiences with therapists and some, well, not so good. I had one therapist who fell asleep in a session, another who totally forgot my session, so I sat outside her office for an hour only to have her show up with a coffee in hand and tell me that I was easy to forget. I think she meant it as a joke, but for someone who struggles to be seen at times, it cut pretty deep. And then I've had really amazing therapists, ones that listen empathetically and challenge me when I need it. I love an interactive therapist who helps provide a mirror and a perspective I might not be seeing. There's so much that goes into the right fit for therapy, and I want to share some of my experiences for those that are interested in either seeing a therapist or maybe even thinking about becoming one. There are many types of therapy and therapists. I think it's important to know a little bit about them to make the best decision possible. Not all types of therapy can help all issues, and therapy is not the same as counseling. So let's first talk about what therapy is. The American Psychological Association defines therapy as a collective treatment based on the relationship between an individual and a practitioner. A practitioner, or a therapist, provides a supportive environment that allows clients to talk openly with someone who is objective, neutral, and non-judgmental. Most therapy focuses on individuals, although therapists also work with couples, families, and groups. I describe therapy as a place to meet with someone whose job it is to help me feel seen, heard, and to learn to identify what's truly going on for me. Through the years, it's helped me identify, honor, and feel my emotions. It's helped me learn to communicate what I'm thinking and feeling, to challenge negative thoughts and biases I hold. It's helped me create self-compassion and recognize choices I have to change circumstances when needed. Therapy isn't easy, but having the right therapist can help someone remember they don't have to go through things alone. Although the terms counseling and therapy are often used interchangeably, there is a difference. Counseling focuses on specific issues and is designed to help a person address a particular problem, such as addiction or stress management. The focus may be on problem solving or on learning specific techniques for coping with or avoiding problem areas. Usually it's more short-term than therapy. Therapy, on the other hand, is a little more long-term and focuses on a broader range of issues. The underlying principle is that a person's pattern of thinking and behavior affect the way the person interacts with the world. So for the remainder of the podcast, I'm just going to focus on therapy. So you're probably wondering, what makes therapy effective, or will it work for me? And I think this is a super important question to ask. Research indicates that the most important aspect of effective therapy is the client and practitioner's therapeutic alliance, or what most people call their relationship. Edward Bourdon defined a good therapeutic relationship as consisting of 3 essential qualities: an emotional bond of trust, caring, and respect. Research further concludes that the quality of the client-therapist alliance is a reliable predictor of positive clinical outcomes, independent of the variety of psychotherapy approaches. And what that really means is having a good relationship with your therapist leads to a better success for the client. Kind of makes sense. So why do people go to therapy? Often people believe that in order to go to therapy, something has to be wrong. And while at times that may seem true for some, it isn't always the case. People go to therapy for a variety of reasons, including life transitions, such as having a baby, adjusting to adulthood, changing jobs, or even getting married. They also go to discuss difficult life events, such as the death of a loved one, a loss of a parent, addiction, and having a serious physical illness. One main reason people go to therapy is for self-discovery. Think for a moment about the last few years since the start of the pandemic. Everyone's life was turned upside down and had to adjust to cope with these changes. In my house, both my husband and I still had to work, ensuring that our 3 children performed at school, while also assisting my parents with some tasks. It was a stressful time. It also gave us a chance to spend quality time together and also learn a little bit more about ourselves and what we want. And we aren't the same people now than we were before the pandemic started. The reality is, even if you're not facing a specific issue in your life, some people seek therapy for that self-discovery and self-improvement. It gives us a chance to reflect on our past experiences and explore feelings and values. This can improve our sense of self and help us feel more satisfied in our lives. There's a really great line in the Apple TV series called Shrinking. If you haven't seen it, you should totally check it out. It's a show about a group of therapists dealing with their own life issues, in which one describes the perfect reason to get therapy. He states, "Because nobody gets through this life unscathed." How's that for truth? No one goes through life unscathed, unaffected, or without pain. Therapy helps you realize you aren't alone, and you don't have to carry the weight of it all by yourself. What I love about the show, besides the incredible chemistry among the 3 main characters, is that they portray a behind-the-scenes look at therapy. The fact that it doesn't always have to be serious, that everyone struggles, and that healing can happen. Are you a therapist looking to grow your practice and help more people in need? Look no further than Headway. Headway is the leading therapy referral platform that connects individuals with top-rated therapists in their area. By joining the Headway network, you'll have access to a steady stream of new clients who are seeking the help and support that you provide. Being a Headway therapist allows you the flexibility and support you need to promote your services and increase your visibility in the community. Joining the Headway network is easy and free. Simply sign up online, create a profile, and start receiving referrals from individuals who are seeking your expertise. Head on over to www.authenticandbrave.com/Headway to get started today. Some possible signs you might want to see a therapist include you're experiencing anxiety in your everyday life that just doesn't seem to go away. You're feeling overwhelmed and stressed. And these are impacting your physical, your sexual, or your relational health. Maybe you're feeling fatigued a lot, or you just don't have interest in activities like you used to. You may be experiencing increased levels of irritability or anger. Or worse, maybe you lash out at people without meaning to and can't seem to really control it. Or maybe you're just really hard on yourself. You perseverate on past mistakes or even things you said or how someone might have taken it. These are just a few reasons to see a therapist. The American Psychological Association has some good guidelines that may also help you consider when to see a therapist, such as thinking or coping with the issue takes up at least 1 hour each day. The issue causes embarrassment or makes you want to avoid others. The issue has caused your quality of life to decrease or negatively affected school, work, or relationships. If you experience any of the following emotions or feelings to the extent that they interfere with life, therapy can really help. Okay, so here's what we do know about therapy. Therapy can help improve symptoms of many mental health conditions. According to the National Alliance on Mental Health, approximately 1 in 5 adults in the U.S. lives with a mental health condition. And yet only approximately 25 to 40% of those get help. Left untreated, mental health issues often get worse and may have other negative effects. They could also lead to increased risk of health issues, inability to go to work or school, difficulty in relationships, or even difficulty taking care of children. I can remember after my second child, Nolan, was born, he had a really bad incident with acid reflux to the point where he threw up and stopped breathing. And I'm telling you, this really scared me. We spent a week in the hospital and luckily got him to the right doctors and gave him the right medication, and it never happened again. Too bad my nervous system didn't bounce back so quickly. I spent the next 6 months not sleeping, worrying every time he coughed that he might be choking, and I really struggled with my anxiety. I was a hot mess. I needed help, and I went back to therapy. There, I was able to process my feelings, I was able to grieve, and I learned new techniques to settle my nervous system. Now, I'm not going to lie. Therapy didn't erase my anxiety completely. I still react with anxiety when Nolan is sick, but I now know how to calm my nervous system and recognize what and why I'm feeling the way I do. Therapy is what helped me know how to do that and learn some new skills. See, for me, therapy gives us a safe place to explore our thoughts, feelings, actions, and relationship, as well as how to learn to cope with overwhelm, negativity, fear, and many other issues. Research shows the benefits of therapy last longer than medication alone. Medication can reduce some symptoms of mental health conditions, but therapy teaches us skills to address them. Are you a fan of young adult fiction, magic, and adventure? Then you won't want to miss Kindreds, the thrilling new fantasy novel from author B.B. Russell. Join our heroine, 16-year-old Lila, after the death of her last living relative when she reconnects with a boy named Joey from her childhood who harbors a secret. Needing to know what it is, Lila follows him and finds herself in Carnival Noliana, a disappearing world of magic and wonder, hidden just beyond the veil of the ordinary that is looking for 10 new members. With Noliana set to disappear at the end of Masquerade in 4 days, Lila must decide if she should follow her heart and Joey into Noliana for good, or trust her instincts and intellect that Noliana may not be what it seems. With unforgettable characters, a battle between listening to one's head or one's heart, and heart-pounding action, Kindreds is the perfect choice for anyone who loves young adult fantasy. So don't wait, pick up your copy today and embark on an epic adventure you won't soon forget. Kindreds by B.B. Russell is now available at your favorite bookstore. Or at www.authenticandbrave.com/kindreds, KINDREDS. Okay, so what types of therapists are there? I'm going to briefly describe 4 specific professions that train therapists, though there are several others. The 4 are psychiatrists, psychologists, clinical social workers, and mental health counselors. And I'll describe them briefly for you. A psychiatrist is a medical doctor who's trained to differentiate mental health problems from other underlying medical conditions that could present with psychiatric symptoms or mental health symptoms. They can write prescriptions, and sometimes they even do therapy, though not as much as other professions. Then there's psychologists. A psychologist has a doctoral degree in psychology, which is the study of the mind and behaviors. They are trained in evaluating and treating mental and emotional disorders. They're qualified to do counseling and therapy. They perform psychological testing and provide treatment for mental disorders. They are not medical doctors and do not prescribe medications. I'm a licensed clinical social worker. Licensed clinical social workers hold a master's degree in social work and are licensed to provide diagnoses and counseling and therapy services to individuals suffering from mental, behavioral, and other emotional issues. They often focus on the individual within their different environments or systems, as well as providing treatment for specific mental health disorders. The last type of professional is a licensed mental health counselor. A counselor is a mental health professional who has a master's degree in psychology, counseling, or a related field. The American Counseling Association states that counselors empower diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. Mental health counselors are not able to do therapy, but they can do counseling. I often get asked which type of professional is better. And I'm just going to say, I know that I'm biased. I'm a clinical social worker and I train social workers. While I myself choose to see social workers because I know their training is robust and takes into account both the individual and systemic factors impacting a person's well-being and mental health, the real answer is that the best type of therapist is the one that works for you. It is about the relationship and whether you feel comfortable with that person, the way they talk to you, how they show empathy, and how they help you feel empowered. There are some things to consider when looking for a therapist. First and foremost is, are they licensed? There's several different levels of training, supervision requirements, and ethical guidelines for each profession. Ensuring the person you're seeing has a license ensures that they've met their specific professional guidelines and training requirements to be able to see clients. Unfortunately, there are many people who see clients who are not licensed and place clients at risk of undue harm or re-traumatizing them. Therapists and counselors have specific tasks they do based on their training, and this goes along with licensing. You want to make sure they are practicing within their scope of practice. For example, as I mentioned, psychiatrists can prescribe medication. A psychologist or a clinical social worker cannot. And they shouldn't be giving advice on medications because, again, it's not part of their scope of practice. Another thing to look for is when you meet with a therapist, do you feel seen and heard? Are they really listening to you? Do they honor how you feel? Do they provide a safe place free of judgment? Therapists are not advice givers. They shouldn't be telling you what to do. They help you identify and work through choices, but again, they're not to tell you specifically what to do or how to problem solve. You are the problem solver, and you do know what's best for yourself. A therapist can help you understand your choices and reflect back to you what you're saying and help guide you, but not direct you. Another thing is, does a therapist show curiosity about your life, your values, your culture, your identities, your spiritual and religious beliefs? Do they ask you how you think therapy is going? Do they ask for feedback about sessions? Do they ask you if you feel like you're making progress or what's different from the last session? These are all important things that show the level of therapist interaction and interest and ensuring that you're not just meeting just to meet. You're making progress towards a goal. It is absolutely okay to ask what type of training a therapist has, if they're licensed, and what modality or style they use. Not everything works for all people. There are so many modalities, including cognitive behavioral therapy, motivational interviewing, dialectical behavior therapy, solutions focus, psychodynamic, play therapy, creative arts therapy, and so many more. Feel free to ask them about it. Ask them about their supervision and what modality they most likely will use with you. So, how do you know it's a good fit? You need to trust your gut. Meeting with the person, asking questions, and if it's not a good fit, that's okay. It's okay to advocate for yourself or change therapist. When I first start with a new client, I always do a free 20-minute consultation. It's a great way to meet with the client and assess if I'm a good fit and if they feel the same way. I tell clients when we end the consultation that it's absolutely fine to take some time to think about it, whether they want to make an appointment, whether they want to do additional consults with other people, or if they feel it isn't a good fit, and then I refer them somewhere else. I know my style doesn't work for everyone, and I'm okay with that. I encourage potential clients to get curious about the work we'll do together and how we will know if they're making progress. Therapy isn't meant to be every week for the rest of our lives. Progress is important, and the main goal is that clients have improvement and will no longer need to see me. So, what happens if you go to therapy and it doesn't work? If you listen to episode 4 of the podcast, my husband and I went into our experiences with several different couples therapists. It took many tries, probably 4, I think it was, before we actually found one that worked for both of us. We had to try out several before we were comfortable and felt heard. The truth is, therapy doesn't always work right away. Even in an ideal therapy situation, it can take time for your symptoms to improve, for you to feel comfortable, for trust to be built, and for you to open up. Working through challenges isn't easy, and therapy isn't always a quick fix. But if you're willing to do the work, it can be rewarding. It's a safe, judgment-free space where you can share anything with a trained professional who is there to listen. I hope after you listen to this podcast today that you understand a little bit more about what therapy is, the different reasons to go, and some tips for finding the right fit for you. If you still have questions or want to share more about your experiences with therapy, please send me a DM on Instagram at Authentic and Brave or post on the Authentic and Brave Facebook group. I'd love to hear from you. And remember, therapy can benefit anyone through learning about yourself, achieving new insights and goals. It can lead to better health, having more fulfilling relationships, and create an overall better mental outlook. So that's it for now. Thanks for listening, and keep on being authentic and brave.
Thanks so much for tuning into the Authentic and Brave podcast. If you want more, head over to the AuthenticandBravePodcast.com for show notes and sign up for the mailing list so you'll never miss an episode. If you're looking for inspiration, connection, and people like you and me, be sure to join my exclusive community on Facebook. The link's waiting for you at AuthenticandBravePodcast.com. This is Dr. Beth Russell signing off. See you next time.